I loved being pregnant. I really did. At the time, I worked in the ICU, many hours, 12 hours plus. At the time, I worked with an organization that we would work at bedside sometimes 24 hours in a shift. So being pregnant while nursing, it's very grueling and hard, very hard. You know, the best thing for me at the time was taking Tylenol, using heat packs, putting your feet up. You know, you try to do all the holistic things as possible, but then the best pain relief at the time was Tylenol. And, you know, your doctor recommends it. When you work 3 shifts a week, that's at least 3 doses of Tylenol. And that was how I helped relieve my pain. The first couple months, once he hit like 5, 6 months, I remember having a conversation with my mom about him not having good eye contact. And my mom would joke that he can't look at the beauty, you know. As the years went on, he couldn't point. It was a motion like that or just not recognizing how to do it. So that first year there was little suspicious things, but it's your first kid and everyone's like, everything's fine, don't worry about it. And then closer to his 2.5 birthday, we went in for a possible ear infection, saw a different pediatrician. It was his primary pediatrician's partner. And she said, you know, I think we need to look into some things because he didn't look at me when I walked in. He's flapping his arms. We just need to get him evaluated. He's not talking yet. Does this kid fit a potential autism diagnosis? And then you get a phone call and they say, okay, go to this clinic. He's going to get another evaluation. And this clinic is a clinic that he still goes to today, actually. So he went in for this 3-hour evaluation with physical therapy, occupational therapy, speech, an ABA therapist, which is an applied behavioral analysis therapist. They're the main therapists in the world of autism. And they said, yeah, he requires some services. And I remember them saying, he has autism. He fits all the criterias, and we need to make sure that all of your therapy is in line. We want to look at his IEP. We want to make sure that he has a good program to moving forward. And I was crying, and I felt so silly for crying because I was like, I knew this was going to happen. I was hoping it wouldn't, but to hear somebody else say it, when, you know, your family, everyone is like, well, we're going to see. We're just going to see. We're going to see how this goes. It was finalized. So do I think that Tylenol caused Devin's autism? I think that right now it's the only thing that points to it. We've done full DNA genome sequencing. We've done mitochondrial testing, urine testing, looking at hormones. I mean, you can't get much better than DNA testing. Nothing points to it like Tylenol does. And I think that that's why this lawsuit is important, because you're going to have professionals pick apart data and come together and figure it out. All the data and research can say this is linked to it, but until there's a suit where both sides can come and converse and figure this out, are we going to make any progress? So I don't think the suit is a bad thing. I think it's opening up a conversation. I really want to be able to change the process. I'm hoping that things can be improved for future parents and people with autism, that the whole getting diagnosed, getting treatment, getting therapy covered is not such a fight. So I think that it brings peace knowing that we might be able to help others, because it's a hard battle.